Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness and muscle medicine, hormone optimization, peptide therapy, and much, much more. So hopefully everyone is having a great week. Today I'm going to continue on talking about testosterone. I do a lot of talks about on Testosterone Tuesday, of course. So today I'm going to talk about testosterone in blood. So probably should have done this over Halloween when we talk about vampires of blood and stuff like that. But hey, I'm going to throw it in there now anyway. So this is a common thing that comes up in questions and comments on posts and media and questions by patients about the blood. You read a lot about how and concerns about testosterone affecting the blood, your blood count. So your red blood cells, of course, are the oxygen carrying capacity component of the blood, right? There's red blood cells, there's white blood cells, there's platelets, all these different components of the blood. One of the concerns and questions I get about is, doesn't testosterone thicken your blood? Doesn't it raise your blood counts? And so I'm going to address that today. So the biggest thing is this, and it comes from two sides. There's the medical side, where I hear it from other practitioners or nurses or clinicians, et cetera, or in journals, medical articles, things like that. And then there's the patient side. So on the patient side, of course, that's the question. Well, I heard it causes blood clots, or it can thicken your blood, and I have to go donate blood every now and then, things like that. On the medical side, you read about, testosterone causes polycythemia vera. What is polycythemia vera? That's a medical condition. It's actually an inherent condition, a defect in the processing. It's more of it's almost similar to an autoimmune condition where it affects all of your blood cells. So you have like I said, the red blood cell component is the hemoglobin, hematocrit, and then there's the white blood cells, the infection fighters, amongst other things, and the platelet counts, which help to clot your blood, for example. So in polycythemia vera, it's a genetic condition where all of these are affected, all of these are raised. So what the difference is with erythrocytosis is just an elevation of the erythrocytes, which is the red blood cells, the hemoglobin, hematocrit. So testosterone can raise red blood cells. It can. It doesn't always, but it can. But it does not affect your white blood cells and your platelets. That's the difference. So if you read medical literature, it drives me nuts. One of my mentors, Neil Rouzier, is always talking about this and harping on this, that it's not polycythemia. You'll see this in the literature, testosterone and polycythemia. It doesn't cause polycythemia. It can cause an erythrocytosis. It's a huge difference, massively important, because there's a totally different treatments and different therapeutic outcomes and different diagnostic criteria as well. So again, it's just the red blood cells, not the other two. It's more of a whole different treatment condition. Again, testosterone can elevate the hemoglobin and hematocrit. So the original thought was, well, why? A lot of thought was that it increases erythropoietin, which is a substance made by the kidneys that stimulates red blood cell production. This is not the case. Now, this was the case with DECA, right? It's a well-known anabolic that was actually FDA approved for treatment of anemia from chronic renal failure. That can raise EPO, and that's the one you read about a lot, where a lot of the bicyclists in Tour de France were doping with EPO to increase their blood count so they have more oxygen carrying capacity, therefore they could bike better. But this is not the case. Actually, testosterone actually increases red cell progenitor cells in the bone marrow to produce more blood cells. So that's a huge difference. So I just want to talk about that real quick. And again, this does not really thicken your blood. Yes, it can raise your blood counts, but it does not cause platelet problems or anything else, which is platelets are the clotting component of the blood. Now, of course, you don't want your hemoglobin and hematocrit to get excessively high, but again, with proper dosing, you're never going to have that problem. I've rarely had to adjust that. Occasionally get a patient, you have to recommend that they donate some blood periodically if their blood counts are too high, but usually it's just a dose adjustment. And again, I've rarely had to do that, and my patients have great clinical benefits without any of the downsides. So again, it all comes down to doing it the right way, the smart way. So anyway, so hope you like this. I'm going to talk about this more in the next video too, dig a little bit deeper. But if you have any questions, let me know what you think. Let me know what you want me to talk about, and I will talk about. Please share this post, like it, tag it, show it to some friends, etc. And reach out to me. I'm doing telemedicine consultations anywhere, anytime for hormone optimization more. And partnering with my partner, Alec Gilbert, we have a nice 1-2 combination where you get the full package. You get hormone optimization, peptide therapies, nutrition, fitness consultations, metabolism, and much, much more. So link in the bio. Guys, reach out to us. Everyone have an awesome day, and I will talk to you soon.